All right, fine. Yeah. Hi. Let's hit Barb's other question. I've read it properly now, and ugh, yeah. Okay, so yeah, it's one of these Illuminati questions, and I guess I don't know. Yeah, they haven't sent me my membership card yet, but I'm hoping it's coming in the mail soon. Yeah. So anyway, the idea is that yeah, what if I'm secretly on the make and yeah. Fine, give me a minute. Yeah. One, I'd dress better than this, but whatever. Yeah. Two, I'd probably be able to afford a haircut occasionally, but yeah. We'll get to three, four, and five in a sec. The other thing they're saying is that Texas A&M's got some kind of $256 million facility, which I don't know. They're building things here all the time, but dedicated to vaccine manufacture. I know of two things on campus. They may not be the one that we're talking about here. One is called iBio, and they are doing research. They're affiliated with the university, but they're not the university proper, as far as I know. I'm also not Texas A&M Main University proper. Yeah, um, yeah. I've been generously picked up for a summer research contract, and no, there are no stock options or anything within that. It's just that somebody will pay your salary. Normally, for faculty, you get paid for 9 months of the year, and if you want to eat in the other 3 months, then you have to either teach classes or get enough grants to cover your summer salary, or yeah, have somebody thankfully say, well, we have work that needs done that need, and you may be able to help. We'll cover your summer salary. In which case, you say thank goodness and thank you, and all right, let's try this thing. That's what I'm doing here. Yeah. The other fun thing. So I've got several patents for antiviral things. Yeah, with a couple of companies. And the thing is, anything that you do, say, or think actually belongs not to you, but to the university. So when you get a patent, the thing that happens next is that you get to go down to some admin's office. And the one at Scripps at least had a candy bowl there. Yeah. And they say, oh, here you go. Here's your paper, and you're going to release this patent to us, and it's actually written into the job conditions. Basically, because you came up with it and you are paid by us, therefore we own this patent now. Yeah, thank you for your service. You think it's basically part of the deal. So you have to be not working at one of these places or have some incredible contract that I don't understand, or you can. This is fun. You can pay the university to license back your own idea and then run a company with it, but it's like a way of making sure that they get their cut. They're gambling basically on, yeah, having faculty members produce something of value. And when it happens, this can be good for the university. And they try to find some way. They may like put together some kind of little startup incubator for your company if it's a good idea that they like. But yeah, yeah, because they have a vested interest in that. But yeah, I do not, unfortunately. So I know iBio are working on some kind of, I think it's an epitope based SARS-CoV-2 vaccine. I think it's in plants. There were some announcements about that. So epitope based means they're not making full virus proteins. They'd be making little tiny bits of virus proteins, maybe all kind of glued together to make this sort of little monstrosity thing that is all the good stuff and none of the bad stuff. I don't know. Yeah. I don't think that stuff actually, that approach actually is particularly useful. Um, yeah, it seems like a good idea, but then there's too much that we don't understand about the immune system and too many different ways that it can work for you to be able to cut down the possibilities and still expect a good outcome. But that's my opinion. That's not science fact. That's just yeah, unfiltered opinion. Um, I know there's also a vaccine trial on campus that I think A&M's paying something like $2 million toward, and that may be part of a larger thing. This is a trial for a thing called BCG, which is not a SARS vaccine. Yeah, not a SARS vaccine. BCG is a vaccine against the bacterium that causes um, tuberculosis. And so it has nothing to do with SARS, but what they're hoping is that there are a couple studies in animals that show that maybe when you put this in, it causes a weird kind of, it's almost immunosuppression, but it's also, I don't know, it changes the way some parts of the immune system work. It's part of the way the bacteria hides. And the idea is that if a person has this bacteria and it causes certain changes to their immune system, that it may mean that they have less, they're less likely to die from COVID. But it's that remote. It's like yeah, sort of 5 steps removed down the road. It's not to say that it can't work, and it is a vaccine against a disease that yeah is kind of rotten and nobody should have. Um, but yeah, I don't know. I've looked at some of the papers, and a lot of the early key papers that people cite don't have what we call significant differences between the treatment group that got BCG and the group that didn't. They also use this thing to cure bladder cancer or to make it easier to fight bladder cancer. And it's actually FDA approved for that, which also is kind of crazy when you think about it because there's nothing about this bacterium that is in any way related to the virus or to cancer, but maybe the side effects of the one thing are strong enough to counteract the other thing. That's what they're betting on. So yeah, and also as Barb points out at the end, this is a Barb question. Dr. Bannon is from Texarkana. Yeah, they cover the 9 months of my year's salary, and they're the place where I'm actually employed. Yeah, so yeah, yeah. No, I don't. I don't know. Somebody might gain something from this, but yeah, it's not me. I don't even monetize these videos. Yeah. So if you see an ad before one of these things, that's Google chipping in and taking their little cut. Which fine, they host my videos. I guess that's okay. But no, this is all pro bono, and yeah, yeah. I no, I don't. Yeah, I don't appreciate the. I was thinking it's good that they're being skeptical, maybe, but I don't know, misdirected and kind of nasty from what I'm seeing here. So, yeah, no, heck with that. Heck with that. Yeah, so, yeah, I don't know that you have to tell your friend anything, Barb, but it's up to you. But no, they could check my bank account, and yeah, it's there are no COVID bugs in there. All right, thanks very much. This is Ask Dr.